Hi, today in this video we are going to start a new lesson from civics, the role of the government in health. Children, as an introduction of this lesson, you have already learnt in your previous lesson, that is on equality, that this equality is one of the key feature of government, the key elements of the government. So how the government is responsible to implement the key feature of equality, that in detail we learnt in a previous lesson. Children, now in this lesson, the role of the government in health. So as you know, the role means, what do you understand by the role of the government? It is nothing but the function of the government. What is the work of the government in the health? In what way the government needs to work in particularly the health sector? So that we are going to learn in this lesson. And as you know, in India we have been practicing since our independence the democratic form of government. Democracy is the government we follow in our country. So as per that, in a democracy, people expect the government to do work for their welfare, and of course the government has to work for the people's expectation. Do you know why? Particularly a democratic form of government. As per the definition of democracy, since it is a form of government, children, I have already repeated many times this definition, even though today also, as the situation comes here, I am again revising the same definition of democracy. The democracy is a kind of government by the people, for the people, and of the people. When the government democracy is itself made by government, it is their government, I mean to say people's government, and it works for them, then naturally the expectations of the people from the government is nothing new, or it's not an amazing factor. So all the people in the country, they expect that the government should do welfare works for the people. Now, how could it possible? How could the people wish that the government work for them? Then it could be by providing to the people education, health, employment, housing, or any other developmental works like construction of roads, providing electricity, and etc. So, children, when you look at the subheading of this lesson, what is health? What do you think? In what way this is the work of the government? How could you think this could be the work related to the health of the people? Yes, of course. So the health, what is health? If you go into deep down of the health, it is quite a vast word. So health does not just comprises in one single sentence, or if I say something, for example, the health is nothing but one who keeps ourselves free from illness or injuries is health. But how can we confine this health term up to keeping ourselves free from the illness, or you may say keeping ourselves fit, physically fit and healthy, then is it the only the health? No. Health is not only just in one's own ability to remain free from the illness or injury, but this is very, as I told you, the scope of the health is very vast, in which so a clean water, pollution free environment, education, food, then hygiene, then exercise and games. So these all factors, in fact, they are very important to make the concept of the health a complete one. If we try to understand the concept of the health, then in fact, so these all the points, these factors, they plays an important role behind maintaining a health one. Therefore, a clean water to drink, pollution free environment, education, a food, then what kind of a water is required to maintain a good health? A safe drinking water. Do you know? Yeah, how important this safe drinking waters, and you may be aware, children, that how much the safe drinking water plays an important role. Even if I say more than 75% or 80% of the diseases, they comes through the water only, and the water content in our body is also around 70 to 85%. Then children, one needs to pay the more significance to the water, and as and when you drink the water, it should be, the safe one, it should be a clean one and a pure one. Then only you can keep yourself away from those diseases which are coming through the water, particularly the waterborne diseases like malaria, diarrhea and many of these. Okay, then after that we move to the next point, or the next factor is pollution free environment. Children, this is very, very difficult. However you are rich or poor, that a plenty of money in your pocket, there is no guarantee that you could be able to get a pollution free environment nowadays. That's why, so this is not something by paying a high cost or high price to the a market or a shop somewhere you can go and buy this. So this is not possible. Then this is yours, that yours and mine and everybody's in the society, the duty to maintain the environment clean and complete pollution free environment. Then we come to the next point, that is education. Education here in this context does not mean that educating the people, like making them educated to read and write, but in this context they should be educated about the health awareness. A health awareness is to be educated to the people how important it is. So then it comes to the food. So a good, a nutritious food is very, very essential to maintain the good health. Then hygiene as well as the exercise. So after the hygiene we come to the exercise. Children, so exercise every day is very, very essential to each and everyone. No matter you are a child, you are an adult, or you are an age old. So at every age group, so as compulsorily every day, so at least 1 hour or minimum half an hour exercise every day is must, because so by exercise we can keep our physique fit one, and we can maintain not only the physical fitness but also we would be able to make our mental fitness also by regular exercises. Then we come to the games. Children, as soon as I say the games, so you might be realize that, and today I also realize that so many times I have been heard and oftenly you insist to all the teachers, apart from the regular games period in the school, as and when, like a free period or a absent arrangement period, so then some teachers they go to the class, then you insist them to take you on the ground to play. Then children, of course, now here I realize this how important the games is, but children, there are certain limitations over us. So now and then, every time we can't take you on the playground to play there as a games. But children, as and when you get such an opportunity to play, then one has to make utilize this opportunity at its fullest way and play as much as you wish, and you involve yourselves in these games, so that also at a very large extent helps you to keep yourself a healthy one. Okay, after these factors, so I come to the second point of the lesson here. So children, now you might have understood what is health, isn't it? Okay, the second point of the lesson is healthcare in India. Children, healthcare in India, as however, if we compare today and the data which is given in our lesson, of course, now at this moment, whatever the informations I am giving you, that all based on the textbook resources. Okay. Now, India has the largest medical colleges in the world, and it is also the largest producer of medicines in the world. Children, after that, if we take into data every year, so around 15,000 of doctors every year they are qualifying in our country. And if you take at a look over the overall infrastructures, the health centers or health field, then the hospitals. So in the year of 1950, so 2717 hospitals were there in India. Then after that, if we come in the year 1991, then that the figure from 2717 it reaches to 11,174. The hospitals were there in the year of 1991. After that, again the census of 2000, it shows that again the number of hospitals increased from 11,174 to 18,148. So children, this is quite a old data. Today, definitely this number of hospitals in our country has been increased now. So then, looking at this infrastructure, India is the fourth largest producers of medicine, and also we are the largest exporters of the medicines. Now, healthcare requirements. If we want to enhance our healthcare facilities, then what are the other basic requirements of healthcare centers? Then, for example, doctors, health workers, nurses, healthcare centers we require. A good ambulance services is the basic requirement of the healthcare centers. Then blood banks. So many such things are there, which are the basic things required for the enhancing the basic facilities in the healthcare centers in our country. Then looking at these things, there is, on other hand, the gray area is there, that we equally pay attentions for that gray area also. Though every year more than 15,000 doctors are becoming qualified, we have such a number of hospitals in our country, and moreover we are the largest producers of the medicines, and largest medical colleges are also there. Then is it enough to us? Are we able to provide the basic health facility to the people, healthcare facilities to the people in our country? And what are its drawbacks? So on other hand, equally, I would like to focus over those points also. Children, though these number of doctors are qualifying, but it has become a tendency today. Even if I say no doctor is ready to go in the rural area and work there, but all of them, they wanted to settle in urban areas, in the city areas. Then you think, how could the people, they able in the villages to get the. So I was about to tell you the gray areas where we need to focus over. What are the lackings in our country? That I told you, one of the first important points, that the doctors, they do not want to go into the rural areas and work there. Next thing, that the hospitals are there, doctors put on duty in the villages, but they do not go there and don't make themselves available in the hospitals all the time, and hospitals conditions are very poor. So the people in the villages still, they suffer a lot, and they have to go a long distance to avail the proper medical facilities to the people of villages in our country. Yeah, after that, I would like to draw your attentions over this point, that do we in our country are self sufficient? If we compare the number of doctors and the population, in proportion to the populations, are there doctors enough to treat the people in our country? Then straightforwardly the answer is no. Why? The reason is, doctors, they straightly deny to go in the rural areas and work there. Then how could be the facility provided to the people in villages? Point number one. Next point is, every year, this is the data, more than 5 lakhs of the people, they are dying because of the fatal diseases like tuberculosis and many other diseases. So half of the children do not get the proper food in villages, particularly that too nutritious food. And children, if the people, they are not able to get the proper food, a good food, then they cannot maintain their health properly, and gradually they lose their health, and they become a victim of one or other kind of diseases. And moreover, in villages, the children, that drinking water, a scarcity is every year faced by the people, particularly in a summer season. Right now also the summer season is going on, and if I show you a collage from the lesson, a collage which is the, children, just look at, have a glance over this picture which is given on the front page of the lesson, that a number of the picture clippings are given, a collage is made, and here the two ladies you could see in the pictures over the head, so they are bringing the water from a long distance. And this is not the situation of our country in one or two places, but in most of the areas we see there is a acute drinking water problems. And children, because of this, the proper water availability, the people, they face a major problem, and they become a victim of so many diseases. As I told you, the waterborne diseases. And nowadays, not only the water, but today keeping ourselves healthy has become the major issue. And day by day, so new, not only the communicable diseases but also the infectious diseases are also there. Many viruses are coming like HIV virus, or the nowadays the entire world is facing from the coronavirus, that is has become the fatal virus. The world large, they are fighting against the coronavirus, and we not yet have that the proper medicines to treat this. That's why, so the health care centers, to update them, to make them facilitate with all infrastructure is very very essential and very important, children. So at this moment we could able to cover, children, 2 points of the lesson. Point number 1 is, what is health, and point number 2 is healthcare in India. So the remaining point of the lessons would be continued in the next session, and whatever the doubt, your queries, that will be, children, we discuss in online classes as per the timetable has been given to us. So I think it is a enjoyable class to you and you might have understood. So have a good day and see you in the next